Good morning. As a part of our career growth, many nurses are nowadays going to study laser technician courses or beauty therapist course, laser therapist course, beauty technician, like that ways. So I'm thinking to do a video about DHA online exam for the laser technicians. So 1 week before from the DHA we will get the email that your exam will be in which that day, like that information will be there, and 2 days before again they will send the email that your exam will be conducted on this date, this time, be ready, like that things. And there will be a Google meeting ID also. So at the day of exam, be ready, anytime they will call. So we must be ready, and they will call through our Google Meet, and there will be 2 or 3 examiners. Video call only they are doing, and they will ask the questions one by one. So first of all, they will say introduce, like all the interviews. They will ask introduce yourself or what's your name, like that. They will start the questions. So usually they will ask one question, like scenario basis question, then they will be another questions, then another questions, like all are connected to the scenario. So today I'm just discussing some of the common questions they are asking. So first of all, the first question: how do you prepare the patient for the laser hair removal? The answer is, before starting any laser treatment, a detailed clinical history must be taken. Various hormonal questions should be asked to evaluate the patients, as these might influence the response to laser therapy. It is important to stress the laser provides permanent hair reduction and not removal. The clinician must explain the maintenance sessions are required after treatment. These can vary from patient to patient, from 2 to 4 sessions per year. It is important to explain that finer hair will be more difficult to treat. Patients with the PCOS should be informed that they might require a greater number of sessions than the average. For patients with the PCOS, approximately 10 to 15 sessions might be required. So before the procedure, informed written consent should be collected before starting the treatment. Patients must be stopped waxing, teasing, and chemical epilations at least 3 weeks before starting the treatment. Patients who are sunburned or have a tan should wait for 2 weeks before laser treatment to avoid additional skin damage. Chemical peels and other laser procedures should be avoided on the face for 2 weeks before and after laser treatment. Patients should avoid all alpha hydroxy and beta hydroxy acids, that means AHA and BHA, like that drugs, and retinoids. These all type of medicine should stop at least 3 days before the treatment. If a patient is prone to acne, oral antibiotics can be started 3 days before the treatment to avoid flare up. Full growth should be present on the day of procedure. Then during the procedure, the face should be cleaned and all cosmetics should be removed. The treatment area should be marked. It is important to avoid treating the vellus hair to prevent paradoxical hair growth on the face. Facial hair should be shaved before starting the treatment. The hair should not be more than 1 to 5 mm. Moisturizer should be applied before shaving the area to be treated. Always shave the direction of the hair follicle to avoid folliculitis. Post-treatment care: after the entire procedure is complete, ice pack can be used on the face to minimize discomfort. Proper sunscreen with adequate coverage should be applied. Minimum gap of 4 to 6 weeks must be maintained between 2 face laser sessions. So this is the detailed answer for that question. By saying some of the points, they will say okay, they will jump to the next question. The second question is, what are the causes of hypopigmentation? Answer. The most common cause of hypopigmentation is skin damage, including burns, infections, blister, and chemical exposure. As these wounds heal, scars that are lighter than the surrounding skin may emerge. Hypopigmentation is a potential side effect that can occur after laser treatment. Laser treatments such as laser hair removal, laser tattoo removal, laser resurfacing use intense beams of light to target specific areas of skin. While these treatments can be effective for various purposes, they also carry the risk of unwanted side effects, including hypopigmentation. Third question. How soon do you see result from the laser hair removal? Answer. You can expect 10 to 25% reduction in hair after the first treatment. To remove the hair, most patients need 2 to 6 laser treatments. After finishing the treatments, most patients do not see any hair on the treated skin for several months or even years. Fourth question. Which part of the body should not be treated with laser hair removal? Laser hair removal is used to reduce unwanted hair. Common treatment locations include leg, armpit, upper lip, chin, and the bikini line. With face, laser hair removal can work for many parts of your face, including around the sideburns, cheeks, upper lip, and the chin, but it will not work well around the eyes. The laser treatment might harm some eyes tissues if handled improperly. The closest place that a laser hair removal treatment can work near the eyes around the eyebrow. You can use laser treatment to remove hair near the eyebrows. Actually, the eyebrows means in the forehead while we are doing the eyebrow removal also, but the lower part, that means near to our eyelid, usually we are not doing laser on that eye. The next question. What is cooling complication? Cooling is essential before and after laser treatment. Some laser systems may have built-in cooling devices. While treating a face, ice can be applied on the adjacent areas to prevent dissipation of heat, which can lead to paradoxical hair growth. A cooling gel should be used during the treatment. Protective eyewear should be worn by both the patient and the operator to avoid risk of ocular injuries. So the next question, that's sixth question. What are the hair cycles? The ideal stage for laser treatment is active anagen phase, as there is abundance of melanin and follicles are located deep within the skin and are still attached to the papilla for nourishment. The percentage of hair follicle in the anagen phase may vary among different parts of the body. At a given time, approximately 56 to 76% of facial hair are in the anagen phase. It is estimated that approximately 20% of reduction can be observed with each treatment if done in anagen phase with the use of correct laser light parameters. So the phases are anagen, catagen, and telogen. In that, anagen phase is useful for laser hair reduction. Another one, who should not have laser hair removal? It's a seventh question. Pregnant people who are taking certain medications such as acne treatments, genital herpes, SSV2 are prone to cold sores. Also, people who have keloid scare, raised scare, and those who had skin cancer, bleeding disorders, these people should not do laser. Thank you.